Hello everyone. Today I am going to discuss about non-communicable disorders. So one of the most important non-communicable diseases is diabetes mellitus, generally called as diabetes. Diabetes is a serious medical condition where our blood glucose levels or sugar levels are very high in the blood. It can happen when our body doesn't produce sufficient insulin or when it cannot produce anything. Glucose is the main source of our bodily energy, which comes from mostly from our food what we eat. There are various types of diabetes: type 1 diabetes, type 2 diabetes, gestational diabetes, diabetes due to genetic. Type 1 diabetes, also called as insulin dependent diabetes, and also known as juvenile onset of diabetes because occurs in children. It is an autoimmune condition, which means our body's immune system destroys the cells in our pancreas. This means our body can no longer make insulin. This damage is permanent. We need to take insulin injections daily. Type 1 diabetes can develop at any age but occurs most frequently in children and adolescents. Mostly, this type is due to genetic defects or environmental factors. Next one is type 2 diabetes. It is most commonly seen in the adults. That is the reason used to called as adult onset of diabetes. Another name for this type of diabetes is non-dependent insulin diabetes. 90% of diabetes cases are type 2 diabetes. Type 2 diabetes, also known as adult onset of diabetes, because it is used to occur in adults, but it's become more common in children and teens over the past 20 years due to more young people are overweight or obese. Who have type 2 diabetes, their pancreas usually creates some insulin, but either it's not enough or body doesn't use it properly. So that it is the reason called as insulin resistant diabetes. Type 2 diabetes often milder than type 1, but it can still cause major health complications, especially in the tiny blood vessels in kidney, nerves and eyes. Respectively, these conditions known as nephropathy, neuropathy, retinopathy. So it also gives the furthermore complications, especially cardiovascular diseases and also stroke. Type 2 diabetes is not like type 1 diabetes because we can control and manage with proper precautionary measures like maintaining healthy weight, eating healthy right food and doing regular exercise. Only some people needs medications if they have more risk factors such as heart diseases and obesity. Next variation is gestational diabetes. Gestational diabetes is commonly seen in the pregnant woman. It occurs during the mid or late pregnancies. Pregnancy usually causes some form of insulin resistance. If this becomes diabetes, it's called as gestational diabetes. Doctors often spot it in the middle or late pregnancy. Doctors reports that it occurs 2 to 10% in pregnancies. It usually goes away after delivery. But up to 10% of women who have gestational diabetes gets type 2 diabetes even after years later. Gestational diabetes is more risk for the baby than the mother. A baby might have unusual weight gain before the birth, trouble breathing at the birth time, higher risk of obesity and diabetes in later life. Another type of diabetes is monogenic diabetes. It is also called as diabetes due to genetic defect. These are two types: neonatal diabetes mellitus, maturity onset of diabetes of the young. So these two type of diabetes commonly seen in the young age. Neonatal diabetes commonly seen in the neonates before the 6 months. These diabetes are very rare. As we discussed earlier, genetical and pancreatic cell damage are the main causes of the diabetes. But there are other culprits like sedentary lifestyle, taking excessive food, ultimately obesity, stress, family history, and increasing age also can cause the diabetes. There are many symptoms commonly seen in diabetes patients, such as excessive hunger and excessive thirst, frequent urination, unexplained weight loss and weight gain, tiredness or fatigue, tingling and numbness in the hands and feet, blurred vision, dizziness, and candida like fungal infections. In my next videos, we can discuss more information regarding diabetes and many other topics.